one of the big things in conventional dietitian realm, medical doctors, is to eat the rainbow, get a lot of fiber. It's good for the microbiome, good for the gut. How do you think about that?
Yeah. I think when it comes to microbiome, our recommendations are far ahead of what we truly know from a science standpoint. I had a good interview with Dr. Jack Gilbert, who's a researcher here in San Diego, who's a microbiome expert. We've got it on our podcast. And, he gets so excited about the microbiome because and this is his life and he studies it. But even he sort of admits, we're not quite at the point where we know everything about it, right? Like it's still in its early stages of research. And how do you explain someone who's carnivore, who put their type 2 diabetes into remission or completely resolved their bipolar disorder, or feels the best they've ever felt by eating a diet that quote unquote is supposed to destroy their microbiome, right? So there's a huge disconnect. So the microbiome is one piece of the puzzle, and I'd even say it's a really small piece of the puzzle because is it the chicken or the egg? Is it the leading factor or the responding factor, right? Are we healthier because we have a healthy microbiome, or is our microbiome healthier because we're healthier, right? I don't know that the research is really strong enough to be able to figure that out. Now, microbiome transplants are super interesting. Fecal transplants are super interesting. You can do those now when it comes to something called a C. diff infection, which is totally different. But there's also like in mice and some suggestions that for weight loss, a fecal transplant and changing the microbiome can help with weight loss. But then also you have to go back to, okay, well, what kind of lifestyle is the person doing? Is it high carb? Is it exercise, et cetera, et cetera. Once you take all those other factors into consideration, I think the microbiome is going to have much less of an impact than we think. So yeah, I was under the impression that we all needed to eat our fiber and we needed to eat the rainbow and have a healthy microbiome, and microbiome diversity is key. But then how do you explain these people eating a carnivore diet and thriving and looking very healthy from all objective parameters? You can't, other than to say, well, maybe in some situations it's not as important as we think it is.
Given your answer there, I think I know where you're going to go. But how do you feel about fermented foods, probiotics?
Yeah, look, I think it can be helpful. If you like them, and you think they're having an impact on your health, then absolutely. Like I'm in favor of them. Do I think you need to have them? No, absolutely not. There's no need for them. Yeah, a lot of and to talk about fiber, the majority of the data on fiber comes from high carb diets, and there's no surprise that if you're eating a high carb diet, the diet with more fiber is going to be better than the diet with less fiber because whole foods, natural foods have the fiber, and processed, ultra processed and more of the junk foods don't have the fiber. So you could also say it's just sort of a surrogate for how healthy the diet is, whether in a high carb diet, whether there's, high fiber or not. But once you get rid of the carbs, then how important is the fiber? And you can say the same thing for the fermented foods, right? Once you get rid of the carbs, how important is the fermented foods? Like that's a unique situation that we're learning so much more about. But if you're talking about a high carb diet, absolutely. You want more fiber, you want more fermented foods, you want to, microbiome probably plays a role there in a high carb diet because that's what's been studied and looked at.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Metabolic dysfunction for a lot of doctors, and certainly the way I was trained, is whether or not you have type 2 diabetes. And if you're short of that, you're okay. Metabolic dysfunction, being metabolically unhealthy, starts at that early stage of insulin resistance when your body